The most important thing to me about being a physician in my practice is making patients happy, is making people feel better. Because at the end of the day, that is the only thing that I think that keeps us in medicine. If you don't have that, you really don't have anything. My name is Dr. Robert Greenfield. I specialize in the treatment of spine conditions as well as joint replacement. I think the most important things that patients should know about me and my practice is that I will be honest with them. I will tell them the truth. I will explain their condition in detail. I want them to understand what their condition involves. I want them to understand how it's supposed to be treated, the appropriate ways to treat it, and what the expected outcomes are. A lot of patients will ask me, well, did you see my x-rays? Did you see my MRI? I'll tell them, no, I don't like to look at that. I like to look at you first. And after the examination, I will take their MRI or their x-ray or whatever study they have, and we will look at that together. When a patient leaves the office, they can expect that they understand their condition and they understand the treatment of their condition. And they also understand the plan, what we'll do. Usually I like to go over scenarios. Patients today with spine problems are approached from so many different directions by so many providers. But where do these treatment modalities play a role in your particular problem? And that's my job, to explain that and make you understand that everybody doesn't need all of these things. It's my job to simplify this in the treatment of your problem. My father is a physician, and when I was younger, in days where physicians still made house calls, he would take me on house calls on Saturdays and Sundays. And I learned at that time the importance of establishing a relationship with the patients that extends beyond the patient's name and extends beyond the patient's diagnosis. I think it's important to make that connection with the patient because a patient needs to trust me. They need to trust me. They need to know that I have their best interests at heart. They need to know that I want them to get better. Being a spine surgeon, I think the most important thing for me to understand and for the patient to understand is that most people don't need spine surgery. So my approach to a patient is first education. I need to educate a patient and make sure that they understand what they have from an anatomical standpoint and from a mechanical standpoint. And if we do need to perform surgery, my philosophy is that a patient needs to understand the details of the surgery. If they don't, I really haven't been successful in what I'm trying to accomplish. I like to call patients at home 1 or 2 days after surgery. Just that transition reassures them, and answering their questions reassures them that everything's okay. And that goes far and makes a big difference. When I see a patient come to the office and they've got a severe spine problem and they have difficulty ambulating and they can't get around, we go through treatment, and subsequently, after having been able to relieve that toll, that pressure from the patient, they look like a different person. I mean, I feel great, they feel great. It's worth more than anyone can describe because that's what I'm here for. That's why I do this.